Hello, in this video we're going to learn long axis hip distraction, which is a technique for pain relief in the hip. This works really well if you have pain that's at rest or things that are irritable very easily. So for example, if you have hip arthritis or femoral acetabular impingement and things are really flared up, this is a technique to help give you some space in that hip joint and help things calm down and feel a little bit better. Sometimes even if you are hypermobile, this can be a technique that works really well. You just have to be gentle and listen to your body. So what you do is you're going to take a strap. It could be a yoga strap. You also could use something like this. This is a little bit stretchier. It's called a super band or a pull-up assist band. It's just like a big exercise band. Tie it to something sturdy. I've got it on my cat tree. It could be your bedpost, it could be a really sturdy table, something that's not going to move easily. And then on the other end, you're going to put your foot, prop it up on something like a foam roller works well, or a pillow is fine. You just want your knee and your leg up a little bit off of the ground. And then you're going to bring the strap around your ankle and then wrap it around once or twice so that it creates a cross at the top of the ankle, just above the bones of your ankle here. So you don't want it below your ankle, you want it just above these bony prominences, the medial and the lateral malleoli in your ankle. And then strap it around, and then you can test it just by leaning backwards. Make sure it's gonna stay in place at your ankle and not slide off your foot. So once you've got it in a comfortable spot, you might have to wrap it once or twice just to make sure it stays. Prop your foot up, lean back a little bit, give it a little stretch, make sure that feels okay. All right, so it's not moving. Then what I'm going to do is I'm going to lay back on my back, like so. And then, again, check your alignment. Make sure your foot is about even with your hip. Lay back, and then you start to like lean backwards a little bit. So you just scoot your butt back and use your opposite foot to give a little bit of a push. And you keep that leg that you're stretching nice and relaxed. You'll start to feel a little gentle stretch in that hip. The pain should start to calm down just a little as well. It shouldn't make the pain worse. If it's making it worse, this is definitely not for you. The whole point of this is to be a self-treatment technique for pain. So you should pretty quickly notice it feels gentle, like a gentle stretch that feels good, and the pain calms down pretty quickly if this is going to work for you. For most people, this is really comfortable and it feels really good, and you'll notice, okay, that does feel a little bit better. And if this is feeling good, you work up to somewhere between 3 and 5 minutes at a time. I wouldn't do like the whole 5 minutes at first. Give yourself a trial of a minute or so. Get up, move around a little bit, make sure nothing else gets flared up because of it. And then as long as that initial trial of a minute was working for you, and then you can hold it a little bit longer. So that's our long axis hip distraction. Give it a try, and if it was helpful, you can do that several times a day for pain relief as needed. If you're not having pain at rest, this may not be something you need to do, and you would move on to other more mobility and strength work. But at any point, if things do get flared up, this is a nice first aid type pain relieving technique. Hope you found that helpful. Thanks for watching.